The history of regenerative medicine. Some people know it as stem cells. Some people know it as mesenchymal stem cells, mesenchymal stromal cells. However you refer the name to regenerative medicine, the advancement of regenerative medicine has come a long way since the beginning of time. It started in the 1960s when stem cells was first discovered. And when it was first discovered, it was one of the most amazing things that science has uncovered in the human body. By the 1970s, the study of stem cells were very pronounced and it was studied everywhere. But due to the inhumane gathering of stem cells at the time, which was usually from embryonic stem cells, where it was from aborted babies and fetuses, and it had fetal cells and embryonic cells within them during the study. Due to the people and the government thought it was very inhumane to use stem cell therapy during that time in the 1980s, and it was stopped by our government. Well, then after a while, during the 1990s, stem cells were brought into play and was thought to be really great, and the study of stem cells began once again in the 1990s. But by the early 2000s, it was once again stopped in the US, and it was halted due to uncertainty of stem cells and regenerative medicine. By 2012, due to the rest of the world studying regenerative medicine, mesenchymal stem cells, or mesenchymal stromal cells, the studies of the scientists, the US government did not want to fall behind and brought it back into the studies in 2012. And FDA started regulating the use of mesenchymal stem cells and other regenerative therapy products. The use of stem cells have been done in the rest of the world since the mid to late 2000s. So by the time the US started in 2012, we were absolutely behind on the use of science for stem cell therapy. In Taiwan, one of the most prominent studies that was done, they took a mice that had a severed spinal cord and injected a gelatin product along with stem cells, and within the next few months saw that the spinal cord actually grew back. Since the mid and late 2000s, many athletes were going into Europe to get their own stem cell therapy done on their joints, on their body, for overall health. From there on, stem cell therapy was used widely in parts of Asia, South America, and throughout the whole European continent. By 2012, the studies of stem cells and mesenchymal stem cells have been widely studied, and the efficacies and also the effectiveness of stem cells were already very high, with people with a lot of hopes and a lot of studies behind them, although further studies still needed to be done. In 2012-2013, this was one of the first spinal cord cases here in the US, where a pilot who was paraplegic after an accident were injected with stem cells into his spinal cord, and for the first time, within a few months after, was able to walk, run, and eventually got his pilot license back and started flying again. Since then, multiple studies, groups, and also experiments have been done. Many case studies have been documented to show the effectiveness and the high effectiveness of stem cell therapy. Well, there's also within many different regenerative therapy, there's also different types. See, regenerative medicine all starts off, let me describe to you from the lower end of regenerative medicine, where you're using your body's contents, growth factors to regenerate your body. You're utilizing your own body, right? all the way up to utilizing other stem cells from placental Wharton's jelly stem cells. So I will start from the bottom and work our way up. Now, this is not due to effectiveness. This is not stating how effective one is, but from our knowledge, it is usually, I will explain the one that is on the bottom, and as we go up, the products that is used will have more growth factors, cytokines, usually more anti-inflammatory effects. We'll start including mesenchymal stromal cells or mesenchymal stem cells, and there will also be an increase in exosomes and other healing factors in the body. So regenerative medicine in general, you can start off with prolotherapy. Prolotherapy is used by injecting simply fructose products, which is part of a sugar compound, into a joint. And when sugar compound liquid is injected into a joint, it's going to cause an inflammatory response. And it's utilizing that inflammatory response of the body to start causing inflammation momentarily, okay, an acute inflammation, which then causes the body to send different T cells, rebuilding macrophages to rebuild that area. And who is prolotherapy for? Prolotherapy are for your more acute problems, non-chronic, non-degenerative, mainly for decreasing pain. But it can take some time to work, but once it works, it may last for a short amount of time, depending on what the cause of the problem actually was. The next step up is platelet-rich plasma, also known as PRP. PRP is utilized by putting your blood in a centrifuge. From there, your medical provider will pull the plasma, which is usually the second layer after the blood has been centrifuged, and then it's used to inject back into a space, a joint, or on a muscle, or it may be used for aesthetics or hair as well. Now, the reason why PRP is used because PRP, platelet-rich plasma, not only does it have plasma, but it also has an abundance of growth factors. With growth factors, it's going to help an area heal. There's also a good amount of cytokines to decrease inflammation and to promote further healing in the body. Well, who is PRP for? In general, PRP has to be pulled from someone who is healthy, who is usually younger, under the age of 45, in order for the body to maximize the amount of growth factors and cytokines in the body. Because after a certain age, your body will no longer have very much growth factors and cytokines. Imagine you pull PRP from someone who is 20 compared to someone who is 80 years old. You're going to have a different accumulation and also density of platelet-rich plasma, and also less cytokines, less healing factors inside that PRP. PRP is also used for not only joints, but it could be used for aesthetics. It could be mixed with different type of products for hair, regeneration, rejuvenation, and also joint problems as well. So it's usually best used for people who are younger, or once again, it will be great for acute problems, some chronic problems as well. And PRP is usually done on the same day, where you will have your blood drawn on the same day. They will use a centrifuge to spin the blood for about 10 to 15 minutes, and your provider will pull PRP, will pull the plasma and inject it back in you soon after. The next step above are amniotic products. Amniotic products, it's from birth. It's part of the birth process where there are concentrates of amniotic fluid. Some of them will have a lot of cytokines, a lot of growth factors, a lot of exosomes in them. And it could be very effective to decrease inflammation, cause regeneration in a body or a joint. Some may have a scaffolding type of property. Scaffolding meaning if there were a tear somewhere in the body, your body is more likely to need something like a scaffolding product to really get and promote the healing of the tendons, the ligaments. It has been shown to also increase blood flow to certain areas. And these products, who is it for? This is usually for older population. Younger population works great. People with tears in the joints, tears in ligaments, tears in tendons, who have been injured for quite a while. And it has been chronic. Nothing else has really helped. This is something where people will want to do before they get into surgery, right? It could also be used for aesthetics, and it could also be mixed with PRP for hair rejuvenation and aesthetics as well. The highest one is products that contain human tissue for stem cells or mesenchymal stromal cells, and these are products that have live stem cells or live mesenchymal stem cells or live mesenchymal stromal cells in them. There's multiple different types because regenerative medicine at its highest level used to be from your bone marrow. So many of the products used to be taken from the bone marrow, where it's pulled, bone marrow is pulled from your hip area, and from there providers are able to separate the bone marrow from the products that has mesenchymal stromal cells. Okay. Now, I will use mesenchymal stromal cells or mesenchymal stem cells or the word stem cells interchangeably. I will call them MSCs. All right. So one of the problems with getting your own MSCs is that by the time we're about 20 years old, you're only running on 10% of the MSCs that you were born with, which means that, for example, if for 1 cc of bone marrow when you were a newborn, if you had 2 million MSCs, what happens is by the time you are 20, you will only have about 2,000 MSCs per cc of bone marrow. That is just a comparison that I want to show you what the difference is. Well, one of the ways that you can look at it is by the time we're 20 to 25, we're no longer growing as much anymore. So our body does not need MSCs. The problem is if you were to get injured, your body actually has a slow healing rate. Now, imagine if someone who is 60 and 70, you have even less MSCs, okay? Drastically less MSCs. So some studies show that you may have 200 times less MSCs when you are 60 compared to when you were a newborn. Now, that means if you already have that much less MSCs, it would not make great sense to pull your own MSCs from your hip and inject it back into your own body, right? Well, another area where they can get MSCs, or they used to get MSCs, is from your fat cells. So there used to be procedures where medical providers will promote, come into our office, we will do liposuction, pull fat out of your body, and from the fat cells we will extract the MSCs. Well, many of those procedures were not 100% safe. There were a lot more risks because with MSCs that were pulled from your body, especially when it's from fat cells have a lot of toxins, a lot of inflammatory factors, and it had to be processed within 24 hours. And most science were showing that 24 hours many times was not enough to process all the MSCs so that they were pure and ready to be used for joint aesthetics or other health reasons. Then there was later on the discovery of MSCs in the Wharton's jelly. Wharton's jelly is the product that surrounds the umbilical cord. Okay, and it's located in the placenta. What science has found is one of the richest sources of MSC is actually in the placenta at the Wharton's jelly at the umbilical cord or outside the umbilical cord blood. From there, you don't have to worry about cells that are contaminated because they're very pure in newborn placentas. Okay, and these are all from moms who have donated their placentas, and they go through heavily screenings to make sure they're free from any infections, diseases, viruses, and bacteria. From there, after the quarantine, the cells are then cryogenically preserved in nitrogen tank areas. They are cryogenically preserved, which means that they are stored at very, very cold temperatures to be ready to be used for different types of medical procedures. So for products containing MSCs, who is it best used for? It's going to be people with more chronic problems, with possible old injuries, tears, degeneration in the joint space, people who are wanting to look for an alternative to possible cortisone shots. Medications might not have worked. Physical therapy by itself hasn't worked. And many people come into our office looking to avoid surgery at all costs. And because it's a more conservative way of doing this than surgery, why not give it a shot? MSC products has been used in many offices throughout the US for helping with knee problems, overall body health, shoulder problems, hip problems, and many other joints. Some people even use MSC products for overall health and well-being, on top of aesthetics and hair rejuvenation. So overall, those are the many different types of regenerative medicine, starting off with prolotherapy to PRP, amniotic products to regenerative medicine MSC products. I hope you learned a lot today. If you'd like to learn more about whether MSCs will help you or whether regenerative medicine is right for you and which procedure might be right for you, don't hesitate to give us a call and contact us via email or phone. We can be reached at 707-474-5688 via text or call. Until next time, hope you have learned a lot, gained quite a bit of knowledge on what MSCs are and how it can help the body. Have a great day.